Hi, I'm Doctor Veda. It's very nice to meet you. Sorry about the wait. We've been really busy lately. So, what seems to be the problem? Okay, right. And is that in one ear or both ears? Okay, both ears. And how long has this earache been going on for? Okay, yeah, that's quite a while. Definitely want to take care of that for you. Now, for your right ear, on a scale of 1 to 10, how bad would you say the pain is? Okay. And left ear, same. Okay. Alright, so you've been having this pain for about 7 days. Yikes. Now, what type of pain would you say this is? How would you describe it? Okay. And have you had any other symptoms with this? Like a cold recently or anything? Okay, so you did have a cold recently. And what symptoms were you experiencing with the cold? Runny or stuffy nose? Yeah. A little bit of a sore throat? Okay. Headache? Yeah. Any cough at all? Okay, so just at the beginning, but that went away pretty fast. Okay. And was it a dry cough or a productive cough? Okay, yeah. And how about your sinuses? Have you had any sinus pain or pressure? Yeah, okay. And any fever? Yeah, okay. So just a low-grade fever. Yeah, alright. And anything else? Okay. Yeah, that sounds like a pretty typical upper respiratory infection, which is oftentimes the cause of this type of earache or ear infection. So, yeah, how long ago did you have this cold? Alright, yeah, so makes sense that you would be having the ear problems now. Generally, the cause of that is going to probably be fluid in the middle ear. I'll be able to see that with my otoscope in a few minutes here. Let me put this aside. And first, I'm just gonna get some vitals from you. I'm gonna grab my blood pressure cuff real quick. Okay. We'll get your blood pressure first. I'll get this round arm here. Grab my stethoscope. Okay. Okay, just relax your arm. Okay, thank you. It gets pretty tight. Alright. Okay. Alright. Back over here. Blood pressure is a normal 120/80, so that's good. And you just get your temperature next. Now, hopefully no fever still. Definitely don't want something like that to last a month, so get this in here. Okay. Alright. So right now, 99. Do you tend to run a tiny bit hot? No? Okay. So that can show that maybe you have a little bit of infection still present. Very, very low if we would even consider it a fever at all. Right. Now I'm going to listen to your lungs a bit, especially where you did have a cough briefly. Just want to make sure your lungs sound nice and clear, okay? Just put this on. Okay, now nice deep breath in and out. And in and out. Very good. Okay. Come around and listen from the back as well. And you can just breathe normally right now. Just normal breaths. Very good. Other side here. Just normal breaths. Good. Alright. So your lungs do sound clear. That's good. Doesn't sound like there's any mucus buildup or anything like that. Alright. And you had a bit of a sore throat. Can you just open up for me just a bit? Okay. And say ah. Good. Very good. Alright. So not seeing any redness or swelling of the throat. That is good. Now I am putting on some gloves because I am gonna touch around your neck to see if we can feel any swelling. Check for some swollen lymph nodes. Okay. Alright, so I'm just gonna come in. I'm just gonna gently palpate your neck. Alright. Yeah, I do feel swelling on your neck. Just a little bit for those the lymph nodes, especially up around in here. Okay. Is that tender at all? Okay, good. So no pain. Alright, that's good. I'm gonna touch along your throat as well. Go ahead and swallow for me. Okay, so that feels fine. One more time, swallow again. Okay, that feels alright. Okay, so now I am going to look at your ears. Start on your right ear. And just looking at the outside of the ear to start here. I am going to pull your ear very gently. Touch it. Does this hurt at all? Okay, good. Alright, just looking around the outside of the ear. No issues here, not seeing anything abnormal, which is good. No redness. And if I touch right here, does this hurt at all? Okay. Left ear, same thing. Okay. Any pain here? Okay, good. This looks normal as well. Okay, no redness. Nothing on the outside. And if I touch here. Okay, good. I wouldn't expect there to be anything on the outside of the ear. Just check to be safe. Alright. So now I am going to be looking inside the ears where you do have pain and sensitivity. I'm going to be as gentle as possible. Let me know if anything hurts. Okay, starting here again, your right ear. Okay. Alright, just being as gentle as possible. I don't want to cause you any discomfort. Okay. see a fair bit of redness and a bit of earwax. I want a better view of eardrum. Let me just gently pull back on the ear. Okay. Unfortunately, looks like the wax is sort of blocking my view of the tympanic membrane or eardrum. Okay. Yeah, we're gonna have to clear out some of that earwax. I want to see the eardrum because I'd like to see basically behind it, see what's going on in the middle ear. I have a suspicion that you do have fluid trapped there, so definitely want to check that out. Look on the left side as well. Okay. Same thing, going to be as gentle as possible. Yeah, see some redness and a little bit of swelling. You can definitely tell that this has been pretty painful for you. I can see a bit of the eardrum, but again, that wax is going to make it a little hard for me. Okay, I'm going to come in here. Okay. Yeah, I'm going to need to clear out some of that earwax here as well. Okay. So, I am going to, as gently as possible, clean out this wax that is blocking my view of your tympanic membrane. As I said, I really want to see if you have fluid trapped in your ears, and also if there are any issues I can see with the eardrum, such as scarring from prior issues, possible perforation, any discoloration, either bowing out or caving in. That can be a sign of pressure issues. Have you been having hearing problems? Okay. Yeah. It could be the wax, but it's likely because of the infection as well. So I'm going to go ahead and use this tuning fork quickly and let me know when you can hear this, okay? Okay. And when do you stop hearing it? Okay. And this side. Okay. And when do you stop hearing it? Okay. And I'm gonna say a couple words in your ear. Can you repeat them back to me? Butter, symphony, books. Okay. Orange, ice cube, lemonade. Alright, so it is that you're having a little bit of trouble with that. Yeah, okay. So, let's start by clearing out that wax and see how that goes afterwards. So I'm using this little curette. I'm just going to do a very gentle wax removal. I don't have to get out every last little bit, just enough to give me a clear view of your eardrum and what's behind it. So I'll be as gentle as possible and we'll get that taken care of, okay? So I'm going to come in here very gently. Alright. We're just very gently scraping the wax out. Good. How's that feel? Is that okay? Okay, just a little uncomfortable. Yeah, with how red and swollen your ears look right now. I totally understand that. Be as gentle as possible. And like I said, I'm not trying to get out every little bit. If you find after the infection subsides that you're having earwax issues, you might want to come back to get that thoroughly cleaned out. enough right now. Okay. Alright, I'm gonna give that ear a quick break. I'm gonna come over to your left ear. Okay. How's that? Is that okay? Alright. Good. You're doing a great job. I know this is probably pretty uncomfortable. Just want to get enough so that I can see. Alright. I come back over to the right ear. Okay, very, very gently. Alright, almost done there. You're doing so well. Okay. Great job. And last time in the left ear. Alright. I should be able to see the eardrum very clearly after this. Just make sure there's nothing too serious going on. Okay. Very good. Alright. And I'm going to come in again. The otoscope, take a look at the right ear. Alright. Just looking in here. I'm going to pull back on your ear just a bit so I can get a clearer view of the eardrum. Okay. Yeah, redness there. Luckily no swelling or caving of the eardrum, so that's good. But I can see the fluid behind it, just as I thought. Okay. Let's look here. Yeah, just red and tender looking. The fluid behind it, other side. Okay. Okay, yep, I can see that. Pull back again on your ear. Okay. Same thing here. A little bit more red. Very similar though, and I can see that fluid back there in the middle ear. And that's really probably what's causing this hearing issue for you too, as well as the pain. Okay. Alright. And I'm gonna start the tuning fork again. See if the hearing is about the same as it was before, okay? Let me know when you hear it. Good. And when it fades. Good. Another side. And when it fades. Good. Okay. And if I do it right in the middle, is it equal in both ears? Okay. Alright, yeah, it seems like your hearing is about the same as it was with the wax in there, so it does seem like the fluid is impacting the hearing, which again is it's really due to the eardrum not being able to vibrate properly. So that is what affects the hearing there and your perception of what you hear. So the reason that you do have fluid in there is likely because of your infection that you had, your cold. And what happens is our ears, you eustachian tubes in your ears can swell a bit, and the fluid can get trapped in there, and then if your body is producing more mucus too, it can get trapped in there. So that's pretty much what's going on right now. And where this has been going on for so long at this point, the best course of action is going to be to get you some antibiotics. Do you have any medication allergies? Okay. I'm going to use amoxicillin. And along with the amoxicillin, I am going to prescribe you some eardrops that should help with the pain and the swelling. And those can be used twice a day. In the morning when you wake up, and then at night before you go to bed. And that should help quite a bit. With the amoxicillin, you should see relief in about 1 to 2 days. So if you feel all better after 2 days, which you might, it's very important to continue taking the full course of the antibiotic, because if not, the infection can and often does come back. So you want to make sure you take all of them. So we'll get those both sent over to your pharmacy. Which pharmacy would you like me to send these to? Okay. And that's the one on King Street? Yeah, that's the one I go to. Okay. Alright, so I will have the amoxicillin and the eardrops sent to the pharmacy. The eardrops are prescription, so you'll be able to just pick them up with the antibiotic. And again, you should see relief from this in about 2 days. If it's been 5 days and you're still experiencing this pain and hearing issues, I do want you to come back, okay? It's very unlikely, but just in case. So I'll have that sent over to your pharmacy, and hopefully everything will be fine after that. Like I said before, you might want to choose to do a full ear cleaning when this has cleared up and your ears aren't as sensitive, okay? Alright, any questions for me? Okay, well, thank you so much for your time today. I really hope you feel better very soon, and have a great day, okay?